Hello, AGNP students, and welcome to week one of Advanced Health Assessment 1. Today, we cover chapter 9, focusing on cognition, behavior, and mental status. Our goal is to review the neurotransmitters which are involved in regulating cognition and mental status, and of course, how they apply to health promotion and counseling. Let's begin our review with the foundational anatomy and physiology involved in cognition and behavior. I'm pretty sure you remember all of these four neurotransmitters. For example, serotonin, which is involved in mood and sleep. Norepinephrine is the most common too, involved in arousal. And dopamine is another one involved in reward and control. I'm pretty sure you're involved in all of these neurotransmitters. And acetylcholine, it's involved in memory and learning. And most people with Alzheimer's have deficiency in this neurotransmitter. During the health history, it is very important to screen for anxiety and mood disorders like depression or bipolar disorder. Why is this important? Because any history of alcohol or dementia or substance abuse may mimic changes in mental status or mental alertness. Some patients may present with excessive worry or depressed mood, and without screening them properly, these may be confused with memory issues. It's very important to always screen for or consider the underlying medical conditions. It can be TBI, it may be thyroid disease like hypothyroidism too. So a proper mental status exam usually begins the moment you see the patient. When they come to your exam room, or even when you see them coming into the door at the clinic. So we consider their personality, life experiences, and even cultural background. So evaluate their appearance, their behavior, their level of consciousness, even before you talk to them. Listen closely to their speech once the conversation begins and assess their thoughts, cognition, mood, and level of insight. So if you look into your textbook, for example, this box 9-5, you see different levels of consciousness, which I'm very sure you are familiar with this. You covered them in your health assessment or your foundational skills in BSN program or in ADN. So this is just for your review because we'll come back to them later. So when assessing a patient, for example, who has aphasia, one of the techniques which is recommended to use is in box 9-5, giving, for example, 1 or 2 stage commands. So you can assess for repetition, assessing for test comprehension. That's when you give them 1 or 2 stage commands. You can assess for repetition. These are patients, for example, have dementia in advanced stages. For example, if you ask them to repeat words like no ifs and all buts, and this is usually part of the mini mental status exam. So you can evaluate naming by pointing to parts of the watch, which I believe you are also familiar with this. This is just like a recall of information. So you can test their reading capabilities or comprehension. by asking them to read aloud or have them write a sentence. So as we continue our assessment of thought process, one of the abnormalities, for example, might be blocking, which you are familiar with, like a sudden speech interruption. And one of the most common is confabulation, when patients with, for example, Alzheimer's disease tend to make up stories because they could not remember what you're asking them about. Another one is neologisms. That's also most common in patients, for example, with schizophrenia, inventing some words which do not exist. And these are just reminders to show what changes, some of the abnormalities which show up in patients with uh, thought processes deficiency. So this is a continuity of those abnormalities of thought content. The other ones were for thought processes. And for thought contents, for example, these are driven by behaviors that to reduce stress. For example, the most common was anxieties. We all feel anxious at the times. Another one is phobias. Some people have phobias that they cannot control, which may cause them to avoid some behaviors. And patients with, for example, schizophrenia may present with delusions, but these may also present with other patients too. And so you can screen for depersonalization or derealization, which can happen to any patient at a time when they feel detached from self or environment, but most commonly in patients with schizophrenia. So beyond the basic mental status, we perform cognitive assessments. For example, we can assess for perception or hallucinations. We talked about delusions, but also illusions. Mainly, we can check the orientation of our patients. We can use uh, different techniques to assess for attention, for example, using series of seven. That's one of the most commons, or spelling words backwards, which is also part of it can be used as part of the main mental status exam or main COG. So for health promotion and counseling, these are two components which are very important for neurologic or even psychiatric evaluations. So you may wonder, if you work as a GNP, do you have to assess for depression or anxiety? But keep in mind that most patients who will present in primary care, but especially the older adults, may also have anxiety and depression and at the same time Alzheimer's. So it's very important to differentiate between these conditions. Is it anxiety? Is it depression? Or is it progressive dementia or Alzheimer's? And most of the times, patients with dementia also will develop anxiety and depression. And it becomes very difficult to treat these conditions together. But I will leave the medication or the treatment component to your pharmacology class. So one of the tools that you can use to assess for confusion is the confusion assessment method, which is standardized. It meets the criteria for delirium. For example, patients must exhibit features 1 and 2, for example, in acute and fluctuating changes in mental status and inattention. Additionally, they also have to exhibit either feature 3, which is disorganized thinking, or 4, which is abnormal level of consciousness. This is very important, especially when patients present with acute symptoms of confusion. Let me know if you have any questions. Thank you so much. It was a pleasure presenting this first component of week 1. Thank you.